Greetings, folks. Dr. Brent and Coco Season 4 continues with another session of the RSV Miniseries. This is our 8th video. Just to give you an idea, we're going out to number 11, so we're getting close to the end. Chewy and Soka keep giving me dirty looks because I don't mention them often enough. To that I say, you're cute kids, but you can't compare with the star power of Coco Angel. She's like a Sour Patch Kid. She starts off like a crazy monster, but she's really just a sweet, furry bucket of love, aren't you? Anyway, today it's time to talk about available treatments for bronchiolitis. In reality, this could be a really short video. Why? Because there really aren't any. I mean, it's not quite that simple, but just like our discussion about how we evaluate and diagnose kids with suspected bronchiolitis, I'm doing what I can to manage expectations wherever possible. As I've talked before, in our modern age where information is at everyone's fingertips, it is super common to search the interwebs and Google machines for information when your kid is sick. That's totally normal, and I'm not going to discourage that. It's actually a good thing. What happens next, however, can be a whole different story. Looking things up is a great way to take an active role in the healthcare of yourself and your family. Here's some tips to remember. There's a lot of great, helpful information out there for you to find. However, there's also, you'll be surprised, a lot of garbage. So remember that all of us who do this all day, every day for your kids, your neighbors' kids, and kids all over, also worked really hard through years of education and training for the privilege of being able to help you through the healthcare journey for you and your family. So look stuff up, seek out knowledge. It's what we all do here, right? That's what this whole video extravaganza is all about. But use it to generate questions and curiosity. Bring your questions, your concerns, and let's work through it together. Run into something that feels different than what you looked up before your visit? Tell us and ask us to help you understand with the spirit of being teachable in that moment. So back to treatments. There really aren't any, but that's not the whole story. There is currently no vaccine for RSV, at least. However, there are a few in development, and at least one is very close to being ready to go for approval, which is super exciting. There's also a prophylactic monthly injection, which might sound like a vaccine, but it's actually just a preventative. And its use is restricted to babies who are premature and have specific underlying conditions. It's called Synagis or palivizumab. We will talk more about preventative measures next time, with that included, but also a number of other things. When a child has breathing problems, it's common for breathing treatments to be used. Unfortunately, after lots of scientific study and lots of clinical trials, there's no clear documented benefit provided by any of the available types of nebs or inhalers. Now, children who end up in the hospital, especially in the pediatric ICU, will often have one or more nebs, but outside of those kids, we know that breathing treatments do not help. What about steroids? When kids with asthma have an asthma attack, steroids are commonly used to help them. However, this is also a category of medication that, when studied clinically, has not shown any proven benefit. They're not recommended either, so don't expect those whenever your kid's being treated for bronchiolitis. Antibiotics? Well, if you recall, when I showed the picture of the list in one of the previous videos of organisms that cause bronchiolitis, they're pretty much all viruses. There are a couple of bacteria included in our respiratory swab that we routinely do in the hospital, but those organisms usually cause other types of respiratory illness, not bronchiolitis. Common antibiotics that most people think of, like amoxicillin, azithromycin, ciprofloxacin, clindamycin, these are better termed antibacterials. They don't work on viruses. Now, we do use an antiviral for influenza. Sometimes we use Tamiflu, in fact, but only if patients meet certain criteria. However, there's not currently an antiviral that's available to the public or available for prescription that works on RSV, nor on most of the other viruses on our list. The good news is that there may be a few antivirals in the works for RSV, but none are ready for us yet. What does work? Time. The love and support you provide is usually enough for a kid to give their immune system time to clear the infection and heal. In the meantime, rest, plenty of fluids, good healthy nutrition, and all the normal supportive care that you provide are key. In addition, treating the cough with humidified air, vapor rub, and honey if they're past their first birthday can help with some of the symptomatic things. Saline nose drops followed by suctioning with a bulb syringe or other nasal aspirator works best if you can use that before they eat and before they sleep. Finally, if there is something they are doing that makes you, as the child's caregiver, nervous or worried, it's time to bring them in. Review the warning signs video I posted in video number 5 for more information on what to watch for, and the not so concerning signs video, which was number 6, that followed as well. That's about enough for today, friends. Remember, you're doing a great job. If you have any questions, put them in the comments. Chewy, Soka, Coco, and I will do our best to help. We appreciate everyone who's watching, and until next time, keep seeking knowledge and asking great questions, you animals. See you soon.